my name is Anna Yamin, and this year I interned at the Cardiology Center of Houston under Dr. Randeep Suneja, an interventional cardiologist. I decided to do my research project on the PULS test, standing for Protein Unstable Lesion Signature. Essentially, this is a simple, non-fasting blood test that measures the levels of 9 different biomarkers to predict the likelihood of a patient to have a cardiac event within the next 5 years. On the PULS website, they simply put it as a simple blood test that detects the leading cause of heart attacks, unstable cardiac lesion rupture. Whenever the doctor is talking with his patients, there are specific things that will prompt him to administer this PULS test, so that's a really good place to start. There are things that are within and outside of the patient's control. Some things that the patients can control are obesity, their smoking habits, lifestyle choices, or if they have type 2 diabetes caused from bad lifestyle choices over many years. There are also things that the patients can't control, like their age and genetic predisposition. Here I have pictured 3 different types of the PULS test, or rather 3 different results. Patient A here got a normal result, meaning that their risk score was considered within what their age should be. So there's no need for the doctor to take any preemptive actions with any new medications or suggest any lifestyle changes to prevent them from developing any cardiac disease. Next, we have borderline as patient B. Borderline means that there may be 1 or 2 biomarker levels that are slightly off. The patient is not in any dire risk, but it might be good to start thinking about ways that they can improve their health regimen. If they need to start exercising to lose some weight, if they need to cut down on carbs to do the same, if they have to get their diabetes under control, then those are all things that the doctor may suggest. Usually, if the patient is considered on a borderline risk level, there won't be any medications given unless they have a condition like diabetes, which does need to be controlled with insulin. Also, a lot of times with borderline patients, the things that put them over the edge are things that they can't really do anything about. So say they already have diabetes that's being under control by another physician. There's nothing that the cardiologist can do for that except ensure that the patient is doing their normal visits and getting their insulin or whatever other medications they can get. Finally, we have patient C, representing an elevated risk score. The great thing about the PULS test is it means that this is an event that may happen within 5 years. It doesn't necessarily mean that your patient is going to have a heart attack right away, right then and there. So you can go ahead and proceed with other testing. For example, you can do a calcium score in which you measure the amount of calcium buildup within the patient's arteries. This way, the PULS test is being used as a hint to the physician to probe more to see what kind of treatment the patient would need. Here I have detailed a little chart of the 9 biomarkers. Within my project, I went into great detail about the Fas ligand, IL-16, and HbA1c. In simple terms, the Fas ligand initiates cell death and recycling. So in terms of the PULS test, this means that there are cells dying within the patient's body. These cells tend to accumulate in the arteries, become sticky, and build up on the walls. These buildups can form lesions, which may eventually rupture and travel to the patient's brain or heart, causing a stroke or a heart attack. Next, we have IL-16, which recruits and activates immune cells. This can be misleading because, say the patient is fighting some sort of infection. If the patient is borderline and it's their IL-16 that is putting them over the edge, then there's no need to worry. The patient may need to take some antibiotics to help them get through that infection, but otherwise the patient is in good health. If it is an elevated risk score and the patient is having really high IL-16 levels, that means that the body recognizes that something is wrong and it is trying to fight it. This could mean that the patient's arteries are starting to have a lot of wear and tear, so the body takes this as an attack, will send platelets, which again helps form that lesion which will rupture, causing your cardiac event. Finally, we have HbA1c. HbA1c is a 3-month average of the patient's glucose levels, essentially. If a patient has elevated HbA1c, this means that they're either pre-diabetic or diabetic. This is a major concern, as research shows that patients who are diabetic have 2 times the likelihood of having a cardiac event. So this needs to be put under control immediately if already not being taken care of. In addition, patients with diabetes tend to live with constant low-level inflammation. This inflammation, again, helps create that lesion, which will rupture, causing your cardiac event. So essentially, that is what the PULS test is in simple terms. Thank you for your time.